On the commemoration of the International AIDS Day, 1st December 2023, under the theme, Ending AIDS by 2030, Keeping Communities at the Center.
Your Excellency, by the end of December 2022, we usually, working with the data from Ministry of Health, we look at data for 1 year. We recorded 52,000 new infections. A slight reduction from, again, what we reported to you in Rukunjiri. In Rukunjiri, we told you that we had recorded 54,000 in the previous year.
Your Excellency, keep adolescent girls and young women in school to scale implementation of prevention interventions among adolescents and young people, including adolescent girls and young women, provide supportive legal and policy environments for uptake of prevention-related services.
I myself have been on treatment for over 20 years, and although I had AIDS, suffered from cancer, from some of the very bad diseases, I'm now okay. I was dying at 47, now I'm 70, and as you can see, I am very healthy.
Working with partners, we have utilized multiple media channels to reach to the public with HIV prevention, care and treatment messages.
The world can end AIDS with the communities leading the way and with excellent leadership like yours.
Originally, this virus took us by surprise. We didn't know where it was coming from initially, but within a short time we knew that it was coming through sex. And from that time we told people that you can easily avoid this problem. And when they do, it works. It doesn't spread. It doesn't go through handshake. It doesn't go through breathing. It goes through sex. Or originally, it was also going through blood transfusion before we had perfected the checking of blood. So I was now challenging them that now that we know where it is coming from, why is it continuing to spread? But from the data, it seems part of the problem are the young people, 15 plus, who are desperate for life. And they surrender themselves to people who infect them. That's why I proposed to them, and they seem to like it, that please, one of the loopholes was your refusal to implement free education, primary and secondary, in government schools. If you did that, you would liberate these young children from that dependency on other people prematurely. And they seem to like it. So please, let's take it as part of not only capacity building for the youth, but as part of the anti-AIDS measures. The children to go to school, be looked after by Uganda, the Republic of Uganda, should be the one to look after the children of the poor homes, poor families, by providing free education. And they seem to like it. And then, so that was the first first effort. Prevention by talking, but also by removing some of the hard roads, like this one of young people being stuck and being vulnerable. Then through the other programs, the Myoga, the PDM, the families should be able to get income and have the children not so desperate, trying to sell themselves in order to solve the problem of livelihood. Then the second cluster of measures was that in case, for those who already have the virus, then the good thing is that now you can live for a long time, taking the ARVs, provided you take them properly. And then the women who are pregnant, they take the other one which stops mother-to-child transmission. And in that way, it will reduce transmission, but also prolong the life. But you must take the drugs as directed by the medical people. But one of the points I wanted to clarify was to remove the idea that if you are taking ARVs, you can live a totally full life, like the one who is healthy. According to what we have observed in the army, and these doctors confirmed it, that's not the case. When you expose the body to rigorous exercises in the army, I have seen a number of cases where people break down. I don't know whether these new medicines have addressed that, but we lost quite a number of commanders when they went into battle. While they appeared to be all right, but when they went into this hard army life, field life, their systems broke down. So therefore, really to get full value of your full potential of your life, avoid this kauka. That is my message. The other one is the fallback position. If you have a problem, then you fall back on this position.
This message was prepared by Uganda AIDS Commission on behalf of the people of Uganda to His Excellency General Yoweri Kaguta Museveni, the President of the Republic of Uganda, in recognition of his exemplary leadership in the fight against HIV and AIDS in Uganda at the commemoration of the International World AIDS Day, December 1st, in the year of our Lord 2023, at Kibaale in Rakai District, Uganda. Your Excellency, I take the honor on behalf of the people of Uganda to extend our sign of gratitude by that prestigious award that is being brought forward.
In the fight against AIDS, his leadership since 1986, where he has led the leadership within government and the leadership within the Ministry of Health, and through the Uganda AIDS Commission, prestigious award, the HIV Impact Award. In those categories, a technical committee was composed of experts in the HIV and AIDS sector. They did evaluate the nominations, and these are the selected winners for the awards in those categories mentioned, Your Excellency, and these are the 14 recipients representing the individuals, institutions, and also the corporate companies under the private sector who are receiving these very prestigious HIV Impact Awards. I will ask that the Director General of Uganda AIDS Commission stays with the group, and we can now invite you, Your Excellency. Bana Rakai bana ikatuba wengalo bano be ba champion baffe baguno mwaka